Okay, hello everyone. We're going to do an exam of the lymphatic, peripheral, vascular, and musculoskeletal system. Um, so before I started, I washed my hands for at least 20 seconds. So first we're going to start with palpating the axillary lymph nodes. So, sorry, you're probably ticklish. So there we would feel in here. Can you bend your elbow a little bit? So you would feel in here, and we would do that on both sides. Can you see? And then obviously the patient would be in a gown, so that we'd be able to see better. And so we would have her in the gown. That I would feel the palpate that, and also I'm gonna, while we're up here, palpate the epicondyle lymph node. So the epicondyle is right here, so it's like right in here. So tickle. And then I would do it on this side as well. Oops, sorry. Okay, perfect. So while we're doing that, I would be inspecting her arms for, you know, any edema, redness, swelling, how the hair looks. Like if she has one patch here and none here, that would be suspicious. So we would want to look into that. I'm gonna palpate her radial pulse, and I would do this one too. Make sure that they're equal and strong. They are. And then I would feel for the brachial pulse, and I would do the same on the other side as well. So I already felt the radial on this side. So the normal amplitude would be, we would be hoping for 2+ on here, and they feel equal on both sides. So now I'm gonna move on to the lower legs. So the femoral pulse would be, I would have the patient lie flat, and it would be like right kind of in the groin. I don't know if you can see me, like right in this area, because she's sitting and she has jeans on. That's not super helpful, but that I would palpate. Actually, maybe. Is that hurting you? I can actually feel it doing it this way, so that's good. Also, the lymph nodes would be in this area as well, so I would feel for those. So next I'm going to do pulses. I don't know if you can see down here. I'm sorry. Okay, still can't see that well, but we're going to go with it. So, sorry for all the color here. Still can't see. So if we could bend the knee up like this. Okay, so this is the popliteal pulse, so you would push kind of way in here behind here. And this is one of the more difficult ones to be able to feel, especially with the pants on, but I feel maybe oh yeah, there it is. I can feel it. And I would do it on this side as well. Just bend your knee, there you go. Perfect. And then we would go down to the feet. Can you just take the slippers off? So she should not have her socks on, but we would do oh, coming off, socks coming off. So we would do the dorsal, the pedal pulse. Is there, and then you would do the tibialis. I'm sorry, I'm showing you. I'm not used to videoing myself. Right in here. So then we would do it on this one as well. And sometimes, a lot of times we mark it with an X so that if we want to reassess, we can be able to go back there, because that one is a little different than the other foot. And then this one, oops, sorry. Perfect, right there. Okay, sitting it back up. So next I would assess capillary refill, and she has her nails done, but we can still kind of see not really that well, I'm not gonna lie. Sometimes you can see a little bit this way, but you would want at least faster than, or less than 3 seconds, I'm sorry, for blood return. So you're kind of blanching the finger and waiting for the color to return back. So with the inspection, I would inspect the joints. So the elbow, I would want to make sure that they move well, the shoulder as well. So flexion, extension of the elbow, and then adduction or abduction away, adduction this way. So that she does that, and then we would do the same on this side. So flexion, extension. I said that backwards. Flexion, extension, and then abduction, adduction. So that's good. And then we're gonna move on to the lower extremities. So again, I would examine the skin for color, the size, temperature, all of that down both legs to make sure that they both were even. And then the same, I would want to do range of motions. So flexion, extension of the knee. And then I would do the same for this one. You can't really do an abduction of the knee, but you could do the hip. So you would, bring the leg in this way and then bring your leg out that way, the whole leg. There you go, and then bring it back in. So then we would do the same for the other leg. Actually, I don't think you saw me do flexion, extension. So I would do flexion, extension of the knee like that. So the last thing that we would do, we are going to assess this lower spine. So I'd have my patient stand up. If you could, I'm going to move this chair so you can see everything. So for this, I would have you, we're doing flexion, extension of the waist. So let me have you turn this way so you can see. So I'd have you just bend forward, at the back, and then kind of lean backwards. So stand back up and then lean back. Okay, good. We also do this in x-ray, so that was an easy one for me. And then we'll turn this way, and then I'll have you kind of just twist both sides, just at your hips. So keep your hips, upper body. Twist. Is this your first system? Twist your upper body. Okay, watch what I'm doing. Like this. Okay, just your upper body. Okay, there we go. See, sometimes you have to instruct the patient because they're not paying attention. But while we're doing this, I also would inspect the spine. Just make sure, you could check for scoliosis and make sure there's no step off or anything kind of weird, or if she's having any pain when I push all the way down there. Also, like little old ladies, you would assess for the kyphosis, or sometimes people have this lordosis where they're really like leaning way back, but she does not have any of that. Okay, well, thank you, patient, and that concludes my assessment. And